Welcome everyone to week 5 of the Luminous Virtual Education Series. Before I introduce Dr. Gold, please be advised that all attendees' mics have been muted. However, you can ask questions via the question panel on your screen. Please do ask questions throughout the presentation as they will form part of an interactive Q&A at the end of the session. So let me please introduce you to Dr. Michael Gold, who is the founder of Gold Skincare Centre, Advanced Aesthetics Medical Spa, the Laser and Rejuvenation Centre, and Tennessee Clinical Research Centre located in Nashville, Tennessee. Dr. Gold is a board certified dermatologist and cosmetic surgeon who oversees the various facets of the centre's operations, a combination of medical and surgical dermatology, cosmetic dermatology, aesthetic services, and research endeavours. Dr. Gold has earned a national and international reputation providing patients with leading-edge technological advances and has expertise in all areas of dermatology and aesthetic care. The Tennessee Clinical Research Centre is now one of the leading dermatologic research institutions in the US. Dr. Gold speaks on national and international fronts, focusing on dermatology issues related to the use of lasers and energy-based devices, as well as the use of fillers and toxins in aesthetic and cosmetic dermatology. He lectures in venues around the world and is a sought-after contributor to educational meetings globally. We're thrilled to have Dr. Gold join us today, and at this point, I will hand over presentation to Dr. Gold. Thank you.
All right, thanks, Tracy, and welcome everybody. Let me pull up my talk and we'll get started. So I appreciate the opportunity to be on this webinar today, and what Tracy said was true. I love to come and teach and speak everywhere around the world, and I haven't been able to do that the last couple months. And that's sad and shame, and I know you're all in the same situation that we're in here. I will tell you a little bit about me and a little bit about what the situation with COVID is here and where we are in the process of trying to figure out how we're going to get things back towards whatever the new normal is. And I've been to Australia a lot over the last 20 years. So if you've been around as long as I have, you might know who I am. And for those that are new to this space, I hope to be able to meet people when the next time I can get there. So I do a lot of work in the dermatology, plastic surgery community as far as lectures and research. And as this slide shows, you see at the bottom half, I have spent more time in China than most people ever would imagine going to China. And lots of that has been work I've done with Luminous China and APAC. Luminous is Asia Pacific group. And I've had an amazing relationship with the people in China and the doctors over there. And it's just been a wonderful experience. So I know they're back to work. I know you all are slowly getting back to work. And again, for this presentation, I work with a lot of people, and so this is with Luminous. So before I get into Legend Pro Plus, just really quick on what the situation is in where I live. So I live in Nashville, Tennessee, which is a size of perhaps Brisbane, if you want to compare cities in Australia to where I live, same kind of population. When I've been here for over 30 years, and Nashville was a very small town when I moved here, and now it is, for the last 3 or 4 years, at least 5 years, we've been called the IT city in the United States, as we've had an explosion of growth, mainly in the hospitality business, with the music world, the country music world. I was telling Tracy before this, some of our favorite people from Australia are my neighbors. So Keith Urban has been very vocal, or very much front and center around Tennessee and Nashville, performing lots of free concerts for frontline workers. He has them in their cars, and he'll play concerts in venues that are big enough to let cars in, and then he'll take a stage up and let them and start singing. He has been just an incredible resource for our city during all this. And so that's been really nice. We have been basically shut down for 6 of the last 8 weeks. The city of Nashville still has an increase in cases. Tennessee still has an increase in cases, although everything is sort of opening up. Most of the United States is slowly opening up, and we're all nervous as doctors that we're going to see a resurgence and another spike, which is going to be a really bad problem. But we're all doing things appropriately. My clinic is a very large clinic. In the days pre-COVID, we saw about 200 to 250 people a day, both in medical derm, cosmetic derm, research, all those kind of things. We kept our clinic open during the lockdown, or what we call here, it was a safer at home policy. And they allowed physician offices to stay open for emergencies and essential visits, which took our 200 to 250 patients a day to about 6 or 8 a day. But it was important for me to want to keep my employees employed. So I didn't let anybody get fired or furloughed. We kept everybody employed. We had probably the most spotless office I've ever seen. And we had projects that we were doing, and lots of my staffs that were our providers, I gave writing projects. So everybody kept busy, at least during, that we could do. And we kept the office open for about half the day, 2/3 of the day. On May 4th, we were given the green light in Nashville to reopen with elective surgeries allowed at 50% capacity, under 70 years of age, and following all the US CDC guidelines, which means temperature checks, questionnaires filled out, COVID consent sign, social distancing, nobody in the waiting rooms. And so we decided for the first 2 weeks, we would be at 25% capacity. We're going to take that number up to about 40% to 50% starting next week. We think we've maintained the appropriate care for our patients. On the aesthetic side, during the 6 weeks where we did only essential things, there was absolutely no aesthetic services provided. So no lasers, fillers, toxins, anything in my medical spa, body tightening, nothing was allowed to be done. We did sell skincare products via our website and via phone calls that patients would call in for skincare products. That was fine as a nice little thing to do, but again, that wasn't anything major. And now that we're back in sessions, we are, as I said, we're at about 25% capacity. In the aesthetic world that we have in Nashville, we are not allowed to do things like facials or dermaplaning in our spa because we can't do any hand-to-hand contact. We're not allowing our laser people to do anything ablative, which means no needling of any kind. And nothing ablative at this point in time. So hair removal we are doing body contouring, we're doing various other devices like IPLs and vascular lasers and pigment lasers that we're able to do, but nothing ablative as of this time. We are doing toxins and we are doing fillers with, like, you think you would be walking into a massive cardiac surgical procedure when we do something where we have to take somebody's mask off. So our staff is wearing not only the PPE, but multiple layers of PPE and only taking the mask off as needed and back on as soon as we're done. So it's an evolving process. I am, glad that we're back open. I'm very nervous about a future spike in cases, which, if happens, is going to be a disaster not only to the medical world but to the economy, which is bad enough. And I was telling Tracy, the city of Nashville, percentage-wise, actually was reported today to have had the biggest drop in the financial sector of any city in the United States, more so than New York, more so than Los Angeles, more so than Miami on a percent basis. That has to do a lot because we're a entertainment destination, and that sort of went away. And then on a recent webinar I was on with some of our city leaders, because my wife does a lot with the city leaders, they mentioned that we have had 850 conventions canceled and over $1 billion in revenue loss just on the convention part of it. So we're hoping everything goes well, and that in the near future, which may be 2021, that we're able to get back up and running, although they are making plans to slowly open everything. And if people do what they're supposed to do, hopefully we'll be okay. So with that introduction, which is gloom and doom, I don't want to be gloom and doom. I want to get back to normal. We're going to talk about something called Legend Pro Plus, which is a device you may have heard of. It's a device you may not have heard of. It's a device I really love to talk about. I've been working with versions of this for many years, and Luminous has now come out with the Pro Plus, which is a device that in the US is called Legend Pro, and outside the US, Legend Pro Plus, because the plus part, which I'll talk about, is not FDA cleared, although I've done all the research for the FDA application, so we will talk about the work that I've done. So this market, and again, you have to understand, this is a market that this is a slide set that I put together pre-COVID, all right? So we don't know what it's going to be like in a month, or we don't know like what it's going to be tomorrow. But when we get back to the normality of life, we know, for instance, that there has been a big decline over the last several years in invasive surgical procedures for aging and body contouring. That's just normal. The non-invasive world, the minimally invasive world, has by far taken over the surgical procedure world. It's not to say there's not a role for surgery, and there is when needed. But again, if you have a choice between doing something non-invasively versus surgery, most people would opt for a non-invasive or minimally invasive treatment. So we have devices that are very good for fat, and we have more coming for fat, and this is a very important part of what we deal with. And we'll talk about how we can affect contouring issues, but we're also going to talk about the muscle tissue, which is a very large part of the human body, and we have not spent a great deal of time over the years talking about stimulating muscle activity and how we can do this and do it in a way where we can have a device that can do muscle activation and tightening and needling in one device. So if you want to go buy 3 or 4 devices, that's great. I like platforms that allow me to do to do certain things. Again, we're trying to reduce the subcutaneous fat layer as best we can, and stimulating the muscles to take over a little bit. And workout is a very important part of this. So anytime I start getting into body treatments with patients, whether it's fat removal, skin tightening, body contouring, we do talk about diet and exercise. I will tell you it's important, if you're doing this, put your patients on a scale. Because I've had patients come back to me when I did a lot of liposuction, and a year or so later they would come back to me and say, well, Dr. Gold, the liposuction didn't work. Well, you weighed 140 pounds at the time of your liposuction, and now you weigh 175 pounds. The liposuction is not going to work. So I always sort of make sure my patients understand that diet and exercise is a really important thing that they have to do when we get into this. So the Pro Plus device, the Legend Pro Plus, is got a very high safety profile, very good clinical results. We're going to address fat and muscles. And so far, thank goodness, no complications of any major things have been noted. And again, for years of doing this, there's minimal downtime. And we're going to talk about the different parts of this, which have different names: tripolar, DMA, which is dynamic muscle activation, hybrid energy, and trifractional. So all of this plays a role with the various hand pieces that come with the device, enabling us to do certain things together without changing hand pieces. So this is the indication, at least for the, what we have now. It's indicated for the dermatologic procedures requiring ablation and resurfacing of the skin. When using hybrid energy and trifractional, the applicator that we use for that. It is also indicated for non-invasive body circumference reduction, skin tightening, reduction of cellulite, and treatment of wrinkles when you combine the tripolar and the DMA. So we'll get into all of this during our talk. So it's a multi-platform application platform with 4 clinically proven technologies. So the tripolar radiofrequency is first. It's a what I call bulk heating. It uses bipolar RF in a unique way to deliver energy to the patient. Safe, pleasant, optimal RF treatment. There's also DMA, which is the dynamic muscle activation. So it's muscle stimulation in motion, using the same applicator that we have with the tripolar RF. So you don't have to change applicators, which makes this really important for use. There's also what we call hybrid energy. So this is a smooth radiofrequency assisted ablation, not mechanical force. So we're not pushing needles or stuff into the skin, which is really important. And so we have a safer way to do it. And I'll show you a study that we just finished using some what are called ultrafine needles, which are the sharpest, thinnest needles that we can put in the skin. And then there's tripolar, trifractional, which are RF ablative pin technology. And so pins just touch the surface of the skin and then deliver RF energy into the skin. So it's sort of like after dermal rollers and microneedling pens, and before you get into the RF needling, there are pins. And again, very safe, very good results, but you get all of this in one device, which makes it really, really neat. So there are patents on all this. So again, that's nice, and I just want to make sure everybody knows there are patents. So again, we have different systems and different names that can get confusing, but again, if you just sort of figure out what you're looking to achieve, you can sort of take the deep heating with the tripolar and the needling, and that's Legend M2. And so these are ultra thin needles that get into the skin, this hybrid energy smooth ablation. We're not seeing a lot of bleeding. And again, I'm going to talk to you about the ultra thin electrodes since I did that work for this device. Again, and this is a very useful thing. If you just want to do tightening and muscle activity, this is called Legend Lift. Again, it's treatments of both the muscles and the skin. And again, you can do this for various tissues leading to circumference reduction, cellulite reduction, skin tightening, non-invasive body contouring. And again, you can do all this at the same time or individually. And I'm going to show you a study where we did DMA treatments on the face with this technology. So you may know of others out there that are looking at doing body, and body is huge. But this is the only device at this time that allows us to do facial treatments with muscle activation. And I thought that was really cool to be the one to do the US FDA study on that, which hopefully will lead to that approval shortly. The features of this, again, is that there are muscle stimulation, which actually gets down to the layers of the SMAS. There's real-time temperature that you can use, that you can read, and again, gives us temperature reading, allows us to set endpoints beforehand. With the needles and the pins that you see there, again, you see different things that you're able to treat with these ultra-thin needles that we have. So when we talk about the needling aspect of this, we're not penetrating via pressure. We're doing this through what they call a smart radiofrequency assisted ultra thin electrode smooth ablation. So it's relatively painless. You really don't need numbing when you do this versus the other where you really need to use a lot of numbing. And again, that makes it really comfortable for the patient. So I love microneedling. As I said, I'm not doing it today, but we do it every day in the pre-COVID days, and we will start doing it again. My patients love this concept of RF microneedling. I think it's a game changer for all of us. And so again, I want you to all think about using this when it's appropriate. As far as the clinical effect, when you do a needling procedure with some of these other pens and other RF systems, especially those that have that are coated needles, you see bleeding. And again, when you do it with the thin needles, you don't see this, and we don't see any, we really see no bleeding as a result. The tip design is very unique. The needles are bipolar in all the devices. With the Legend Pro Plus, it's a very advanced configuration. It's ultra thin. Again, very even distribution, as you see on the bottom right of the slide, that you get everything exactly the same, which is actually a luminous thing that in lots of the devices that they've developed, getting energy to be the same in the middle and the edges are as important as anything. And many devices will give you the energy in the middle, and it's not always the same at the edges. With the Legend Pro Plus, I will assure you that the energy is the same. So again, 4 technologies in one platform, which allows us to treat just about anything. So tripolar, tightening, DMA, getting the muscle area, hybrid, treating which is the needles into the dermis and epidermis. And again, if you just want the pin technology, it's really the epidermis and the superficial parts of the dermis. Muscle stimulation, as I said, is a big part of this. You can have hands-free to treat big areas. Legend Pro uses 3 or 6 electrodes in a moving applicator together with the tripolar, which is the bulk heating, to give you this dual effect of muscle and stimulation and tightening of the skin. It's the only device that does this. The muscle stimulation is designed to treat the SMATH layer in a non-invasive manner. So again, we've talked about this. I'm just sort of showing it again, but you can have adjustable depths and frequency for comfort and toning, what you're looking for with the DMA. It works at the level of the SMATH system, and that's really important because that's where the bulk of the toning and shaping the muscles applies. Again, tripolar heats the hypodermis, tripolar RF, we get the fat release because it goes deep enough, and then the reshaping and more fat release when you do the DMA treatment. So it's a synergy of treatments, all working in concert together. And as I said, body is great. We'll show you that. But also on the face, which is really unique because, again, this is the only device that treats the face as well. So the solution here is, again, electrical muscle stimulation in motion. Biphasic frequency with relaxation phase and adjustable parameters that allows us to customize the treatments for our patients to do. And again, there's lots of these treatments that have been done, lots of papers that have been published on how this works for various parts of the system. And I think that's important too. So I'm not going to spend tons of time going into this detailed science. We can go into that, we can do that later, but we are able to adjust the DMA width, which is the duration of the contraction in microseconds. We can adjust the DMA frequency, which is the number of contractions per second, and the height percentage, which is the percentage of contraction amplitude, which is at a maximum of 300. And again, you can get sort of treatments that look like this. And we're going to come back to talk about more treatments in a little while. Again, we've talked about the clinical targets, which are good. And now I want to spend a couple minutes showing you something that I always talk about when you're doing this. So this is sort of the world before DMA came, but tripolar and hybrid energy and trifractional have been around for a while, and the DMA is the new part of the equation. And again, they do different things. RF is colorblind, so we can treat this on all skin types. It works incredibly well in all skin colors. And there have been lots and lots of papers written about this. So when I teach and when I go around talking to people and people come to me and say, you know, well, how do you know it works? I always say, look at what's been put into the peer-reviewed journals. And granted, a lot of these studies are sponsored studies, but if they didn't do the studies, we wouldn't have the data. And again, the data is good. So if the data is good, you know, these are independent doctors like me that do them. I'm not afraid to tell a company the device doesn't work. I've done it. Again, I've been in practice for 30 years, running a research institute for about 25 of those years. And you know, sometimes things work and sometimes things don't work. And when they don't work, most of the time those devices never end up on in the market. So again, I'm just going to sort of show some of this stuff. Steve Shapiro is a dermatologist in Florida. He and I were part of the group that brought this hybrid energy to the United States. This is a paper, again, looking at this needling technology in a pig model, and you see the histology where the needle makes its effect, and then you see new collagen formation over a period of time. This is another paper that I was involved in, again, looking at skin of color and looking at the effect of this trifractional, this needling technology, this pin technology, if you will, on a group of patients that had facial wrinkles, and part of this was looking also at skin of color. My colleague Jeffrey Adelglass is a plastic surgeon in Dallas, Texas. We did the work on this paper. Again, this is Steve Shapiro. This is, again, looking at the tripolar technology for wrinkles. And again, everything is here and all the results are shown. This is another paper from Asia looking at the improvement of using tripolar radiofrequency. So we use this kind of technology as well to treat active acne. And there's been a lot of hype recently in using the needling and pin technology for the treatment of acne. And again, this showed some very nice results when we did that. Again, looking at body treatments, we had improvement in body treatments. Again, on and on. I don't want to, again, I'm not going to spend time. We can get you copies of all of this, but they have been done. They have studied this so many different ways and in so many different journals. And again, this is a study from Asia looking at this. Another patient, this is a group of European patients. Again, on and on and on with improvement and things that are important for us to consider as we look into this, how we can improve patients' outcomes when you follow certain protocols. This is one looking at stretch marks. Again, improvement when you do this. So all of this is out there. Again, very nice papers, very nice publications, and so that's important. So there are about 15 papers plus the two I've added recently. One has been published, one we're presenting at a virtual meeting in about a month, and then we'll send the paper in and we'll talk about it. So let me show you what we've done. And the first paper that is published now, we looked at, and this was work we did last year, looking at these ultra thin needles, the electrode tip for skin texture and wrinkles. So we talked about tripolar and again what it does and as far as skin tightening, but we're also looking at how it works. So anytime you do this kind of work with the radio frequency, you get immediate collagen contracture, which gives us some short-term tightening, and then long-term, again, we all know that it gives us increased fibroblast metabolism, collagen remodeling, firmer skin, tighter skin over time. So we wanted to look at this new system. It is 100 ultra thin electrodes, which are 0.15 millimeters wide and 0.6 millimeters in length. They are the thinnest radiofrequency needles on the market. And that's important because it's comfortable compared to some of the other ones out there. So this was a single center prospective open label study with 12 people, and we measured certain things. So we looked at what's called the Fitzpatrick Elastosis and Wrinkle Score, called the FEWS. We looked at the patient's global aesthetic improvement, and again, safety and tolerance were looked at each visit. We used a visual analog score for pain, but we also looked at safety every time that we did it. We did 3 treatments at 3-week intervals with a follow-up at 1 month and 3 months following the last treatment. Again, those are the parameters we looked at, as well as skin safety during the whole thing. So when you look at the Fitzpatrick Elastosis and Wrinkle Score or scale, you see here that the percent reduction was about 60%, 55%. First, there were no adverse events. There was no downtime in any of the subjects that we treated. But this was very, very significant wrinkle improvement in the wrinkles and in the textures that was noticed in the patients that we studied. According to the global aesthetic improvement, all had an improvement in skin texture. 25% were very much improved, 17% were much improved, and 60% were improved. So everybody got better with this treatment. And again, we picked 3 treatments because that was the study protocol that we chose. There's no reason in certain people that I only do 1 or 2 treatments, and there's other patients that I'm happy to do 5 or 6 treatments as long as they're seeing a clinical improvement when we do the therapy. We did have a little bit of erythema and mild edema, but that only lasted for 30 minutes in most of our patients, and pain was rated to be 3 out of 10. So again, very comfortable for our patients. So you see here the improvement. So this patient, you see improvement in skin texture. So not only had some wrinkling and some very fine wrinkling, but also had a lot of texture damage. And microneedling with this system improves that dramatically. She also had some active acne. That also gets better. Here's another patient with what could be considered rosacea changes or just active acne. I think it's more rosacea, but again, you see improvement in that erythema and you see improvement in the skin texture. And another patient here with improvement in wrinkles, in the skin texture and in the color of her skin to more even texture and tone. Again, that's really important. So again, this was the first time that we looked at these novel ultra-thin electrode tips. 100 ultra-thin electrode array, and again, it proved to be very useful for our patients. And again, very easy with this smooth RF assist ablation method, delivering these needles in a different way, not this mechanical delivery. And so again, the patient satisfaction was really high, minimal pain, minimal downtime, and again, very nice results. The next study that we did was to look at the DMA, so evaluation and safety and efficacy of RF technology combined with dynamic muscle activation, or DMA, for the treatment of facial wrinkles and skin tightening. Again, this was looking at facial wrinkles and skin tightening as well as patient tolerance. Again, we talked about what tripolar technology does. We've talked about DMA. And again, it allows us to adjust as we do. So this combination of muscle stimulation, toning of the isthmus layers, plus the deep heating is this novel combination of RF and muscle stimulation for skin tightening, wrinkle reduction, and isthmus layer toning. So in this study, we had 11 participants, skin types 2 to 4. Mainly females, and again, the wrinkles classification score was 3 to 6. In this study, patients had 6 weekly treatments, and then we followed them 1 and 3 months following their last treatment. We evaluated their facial elastic scores, the global improvement, the VAS all again, as well as skin safety. So here's what we were able to show. And again, understand this was the first time that anybody took a dynamic muscle or muscle activation technology that we know of, and I know there's never been, on the face. So 3 months after the last treatment, there was significant improvement in facial wrinkle and skin tightening. The scores went down by 54%. and that was very, very, very significant. Pain was virtually non-existent. That's also really important, especially when you're treating on the face. And the global improvement was, as you see here, was remarkably high. So our patients got better, our patients enjoyed the treatment, our patients were satisfied, and again, I think we proved what we're looking to do. So again, we're looking to tighten the skin. Again, this is a younger patient, but there is skin tightness, especially seen in the nasolabial folds and marionette lines. Another patient, again, skin tightness and wrinkle reduction. I think you all can see that, especially around the jawline area and so forth. Same thing here, skin tightness, fine lines, and wrinkles all improved. Here, another patient, skin tightness, nasolabial folds, and texture. So we found this combination to be great for an effective treatment, for safe, painless, for the treatment of wrinkle and skin tightening without any downtime. I'm going to go back one slide. So this patient also has photo damage. So another thing to think about is taking your M22 and doing an IPL treatments, and you can actually do it the same day as you do this, or you can bring them back in between treatments, it's fine. But again, adding in technologies that you have to make the patients even better. I'll show a video, we have time, so I'll show this video. And I may not show the whole thing, but so you can actually see the twitching during the treatment. So you see the muscle activation going, and I think that's really important. So I think that's really helpful for our patients to see. So so this combination of things we call Legend Lift, okay? And again, it treats combination for both muscles and the skin. The muscles are being toned using the DMA, and the skin is being tightened through this tripolar or radiofrequency. Again, studied really well. By treating all these layers at once, you can get circumference reduction, or circumferential reduction, cellulite reduction, skin tightening, and non-invasive body contouring when you take this off the face. And so the Legend Pro Plus allows you to treat off the face as well as what I did on the face. All the applicators have the ability to operate both the tripolar and DMA at the same time, or each individually if you choose. So again, we won't show you the video again, but again, you get this effect with the dynamic muscle that we want to see. Again, the DMA works and everything. So this is sort of, this is from my friends in Italy. And I think you can see in the before and after photographs, you know, the improvement, it's comfortable. The results show it, the nice contouring and so forth when you're looking at the kind of treatments that you get here. And this is pretty impressive, especially in the abdomen. You see the improvement in circumferential reduction. You see the skin tightening. On the side, on the right side of the screen, you see the back bra fat area. This indentation is gone. The stomach is sculpted. This is what you can get when you sort of do these patients. The ideal patient is not totally overweight when you're doing muscle activation on the body, but you can really do some significant toning when you do that. You can just do RF if you want to start to get the things going, but the combination seems to work really well. The tips and things on the screen are very easy for us to use. It'll guide you through everything that you're looking for. And so again, we have this tripolar where we can get wrinkle reduction through bulk heating. We have hybrid energy, which allows us to do some resurfacing with our needles. We have DMA, which allows us to do muscle toning all over the body. and we have trifractional, which is this RF ablative pin technology. Again, all 4 in one device, and that's the only device that does it. So again, 5 advantages for this device. The hybrid energy ablates smoothly. The hybrid energy combines thermal and non-thermal chemical effects. There's a very smart tip design. The DMA is, again, non-invasive SMAS level activation, and 4 in 1. So we treat 4 layers of the skin with 4 technologies where we can treat everything from the inside out. This is sort of the disclaimer slide at the end. I just want everybody to know that if somebody has a pacemaker, defibrillator, or any implanted devices in the treatment area, or especially metal in the treatment area, you shouldn't do it. I don't do it if they have a metal in implant somewhere. I'll stay away from that. Again, we tell our patients to be very careful after the procedures, to take care of themselves and so forth. And again, for me, there's not a lot of contraindications for this treatment. So with that, Tracy, I'm going to let you take the screen back.
Great, thank you so much. At this point, I wanted to introduce you to Rhiannon Mitsopoulos, who is our National Clinical Educator, and Rhiannon is going to chair our Q&A session. So welcome, Rhiannon. Rhi, I think you're on mute.
I don't hear her.
No, I can't hear her either. So, okay, I'll start with the questions then. Just one moment, I'll pull these questions up. So first question we have here is, oh, hi, Rhi. Oh.
Can't hear her.
No audio.
We heard her before.
We did. Just give me one moment. I'm going to see if I can unmute her. No, it says you're self-muted, Rhi. Are you there?
That worked. I think you unmuted me, Trace.
I can hear you, yes. Sorry.
Sorry, everybody. I couldn't unmute my mic. Thank you so much for that presentation. That was absolutely fantastic. We do have quite a number of questions come through, so we'll try and get through all of them. A lot of people are asking about this treatment and using it in combination with other devices they currently already have in their practice. And you did mention the IPL. A lot of our listeners today have got the M22 by Luminous. So if you could just talk a little bit about how you combine the IPL and what your treatment protocol is when you do use that in combination with the Legend Pro Plus.
So you can actually, so here's what I tell people. If I'm doing microneedling pins like trifractional and bulk heating, you can do, and DMA, you can do IPL the same day. So you can do all those treatments on the same day. If you're going to add in the needles, the hybrid energy needling, I don't like doing IPL that day. So I would actually treat my patients with the DMA, the needles, the RF. I would actually treat my patients with the tripolar, the DMA, and the IPL in one day, and then 2 weeks later I'd bring them back and just do the needling part, and then 2 weeks later do the other 3, and then do the needling part. So I use IPL a lot when I use these kind of technologies. I think they work really well together, but I do them, so when I do pin technology, I do them all together. When I do needling technology, I don't do the needles the same day. That's just how I do it. That doesn't mean it's the right way. That's how I do it.
Okay, perfect. And when you do those 3, do you do the IPL first, then the DMA? Or
so I don't think it really matters, but because of the fact that you may get some you don't really get any really redness with the DMA. So I would probably treat with the IPL first, and then I would do the tightening and DMA together after that. If you want to do it the other way, you probably can, and it's not going to affect one way or the other. But if I'm doing it in my office, IPL comes first, and then the two of them come after that.
Yeah, perfect, fantastic, lovely. We've got a question here about what are the benefits of the galvanic? So the direct current that is emitted with the RF skin needling. So they just want to know what the benefits of that are. We've got the thermal, and then we've got the chemical side.
So again, when we talk about needling, there are two basic premises for needling. One is that you have coagulation going up the entire length of the needle once it goes through the DE junction, or you have coating, which allows just the tip to give you your activation of the energy. These needles go through the skin, and again, because of the current on the needle as they get through the DE junction, you don't see any of this pinpoint bleeding, and that's the biggest advantage of it. I will say as well, all of these needling devices are designed that if you do things correctly, the incidence of PIH, which is obviously very important as we get into darker skin, Asian, darker skin patients that we treat, the incidence is very, very low because, again, once you penetrate the DE junction, you take that out of the equation. So again, if you do your needling correctly and you have current that allows you to coagulate the tissue, the incidence of PIH is very low. And in fact, in our study, again, it was small, but we didn't see any.
Okay, I actually do have a question about post-inflammatory hyperpigmentation. The question is, I understand that radio frequency is colorblind. However, would you be concerned about PIH in dark Fitzpatrick skin types? And how would you prep Fitz pores and aboves for the trifractional treatment? Is this something you'd suggest, or you don't feel like they need to have any pre-treatment?
So in the ideal world, patients come in, they get a consultation, and you say, okay, we're going to do this procedure in a month. And you prep their skin with whatever things you like to use, such as retinols or any of the vitamin C compound antioxidants to get their skin prepped. If you're using a retinol, sort of stop a day or so before, a couple days before the treatment, and then we treat, and then we post-treat them with whatever bleaching medicines or whatever you have available. I don't know what all you have in Australia. We use a lot of hydroquinone here, but we also have lots of products that block various parts of the tyrosinase pathway. So all my patients are on a skincare routine when I do this. The reality of the world is patient comes in today and wants treatment today. They may not get on a pre-skincare routine, but they will definitely get on a post-skincare routine. And that's important. So again, I think you have to look at the patients and look at the reality of the situation, especially, you know, again, post-COVID. Patients are coming in, most people are going to treat that day if they are able to treat that day when you can. But the ideal situation is obviously to prep their skin, make sure they're on a routine, get them treated, make sure they're on a post routine, make sure they wear sunscreens, because again, you know, you can tell anybody you want anything. And in Australia, if you're in Sydney, they're going to be in Bondi Beach in like a week, you know, within the week. All right, that's not a good thing for what we do. And your climate is, you know, you know, you have the highest incidence of melanoma in the world in Australia. So you have people that love the sun. All right, and so you have to work even harder than I do to make sure people use sunscreen.
Yeah, absolutely. it's definitely one of those things that is a big concern here in Australia. I guess we definitely have darker Fitzpatrick skin types here, but I think compared to America, we don't have a lot. So my take-home message from what you just said is everyone should be prepped. They should be using home care and have a home care routine, but you don't specifically prep for your darker Fitzpatrick skin types to do.
You don't have to, and as I always tell people, again, I've been at this business a long time. The devices that are made, yes, the US is the biggest market, okay? But if the machines don't work in Asia and you're part of Asia Pacific, then they're not going to make it, because again, you have all the skin types. And yes, I have all the skin types in Nashville. So, you know, it's not uncommon for me when we're doing clinical studies for a company to say, I need you to treat 25 Asians of all different kinds of Asian skin. And so we're able to recruit those kind of patients. Or it's not uncommon for them to say, we're doing a study, and of the 50 people we need to be in this, I need 30 that are African American. Again, so we're used to that kind of patient population, more so than, you know, a lot of other clinics, because that's what I do. But PIH we worry about for everything. When you do needling procedures, the incidence should be minuscule. When you do DMA, it should be 0. When you do IPL, unless you don't know what you're doing, it should almost be 0. So again, I think it's really, you know, again, it's the quality of the machines helps us make the numbers for PIH less and less.
Yeah, definitely. And I think the fact that you can customize their treatment settings as well, with the amount of energy that's delivered and for how long, I think will actually make things like less prevalent. I've got a question here. It says, I have heard that skin needling requires pinpoint bleeding to cause collagenesis. If no blood is drawn when doing a trifractional RF treatment, how does the trifractional and the HE help with tightening, texture, and scarring? So what they're asking,
that premise is not accurate.
okay.
So we know, again, as I said, there are 2 ways to deliver needles: coated and uncoated, or insulated and non-insulated. And some people like the non-insulated, which again gives us coagulation amongst the whole tip of the needle, which means almost minuscule blood formation on the skin. Some people like the insulated needles, which just give us collagen or RF energy at the tip of the needles. There have been debates and debates and debates over many different places. The reality in my world is they really don't make a difference. You get the same collagen contraction. If you look at the insulated needles, most of the companies that sell insulated needles tell you to put the energy at various depths in the skin.
Yeah.
Okay, so again, if you're a non-insulated person or liker, why not just put the energy the whole way down? And that way you coagulate the skin, you don't get the pinpoint bleeding, and you get the same collagen contraction throughout the length of the needle, and you get collagen formation that is just as good as anything else. So you don't really need that kind of, that premise that you have to get bleeding. If you're doing microneedling pens, which are the mechanical things you stamp on the skin, you have to get bleeding, okay? Because they're not coated with anything and there's no RF energy. But once you introduce RF energy into the equation, you can do it either way. I like when people don't bleed, okay? And especially COVID, post-COVID, even when I start needling, I don't want anybody bleeding.
No, and I think it's a lot more comfortable for the clients as well. And for those insulated devices where you have to lay them, I mean, to lay them, it means you have to go over the face, you know, 1, 2, potentially 3 times. So that can become just quite uncomfortable for the patient anyway, but also time-wise as well. That brings me to my next question. How many times would you pass over somebody's skin with the RF? microneedling?
So again, that varies on what I'm treating. So it's not unheard of that I will go over some people that have minimal, just I'm sort of doing a rejuvenation treatment or whatever. I'll just do one pass. Most of the time I'm doing 2 or 3 passes if they can tolerate it. And again, with this system, I've not had anybody tell me no to keep going. I'm different. I have like 5 needling devices in my clinic. There are some I can only do 1 pass, and there are some companies that say you have to do 5 or 6 passes, and those people need general anesthesia, and I'm not offering that in my office. Now we do have something called Pronox, which is like nitrous oxide that we can have the patient breathe in, and then I can do as much as I want. But most of my patients, I don't want to use it. So 1 or 2 passes is all I need for this, and I get really nice results.
Yeah, perfect, lovely. If you were to do a male client, and I'm assuming this here would be for the RF, does the male have to shave the area? So if you were doing an abdomen, for example, and they had, hairy tummy, does the client have to shave the hair prior to having the treatment done? Does any hair in the area affect the treatment?
Great question. I honestly can tell people, I say to people, I've heard every question known that nobody can ever stump me on a question. That one just did. I've never been asked that about the stomach. We never shave anybody, but again, I'm not sure anybody's ever looked at that. So again, even if I'm doing needling, I'm doing whatever, DMA, definitely not. Needling, I don't, but I've never looked at if it makes a difference. I don't think it would, and we don't prep anybody with shaving or anything like that. So on the face, if somebody has a beard, I avoid the beard as much as I can, just because I don't want to leave any, if the needling would upset the beard and, they lose some hairs, that's a problem. So I don't want any beard hair, but other than that, on the body, I treat anybody, anywhere.
Yeah, we stumped you. That's great. From my clinical experience, what I've noticed is if they're really hairy on the body, sometimes it can create little air bubbles, and it can you can get that arcing a little bit. So we either just apply the more glycerin to the area and just push a little bit harder, or if they already obviously shave the area, then they can shave the area if they want to, but I don't think it's necessary.
I just think you have to, if they have hair and you're treating, you just have to be even with your pressure the whole time, because again, you don't want to arc the skin. I've not had any arcing issues, so knock wood for that.
Yeah, no, perfect, lovely. And cellulite here, obviously all of the women and the men are obviously down at Bondi Beach, especially in Sydney. So how effective is the Legion Pro Plus for cellulite, and what would be your treatment plan for them?
So again, you have the tripolar, which is the RF technology with the DMA, and so cellulite's a weird thing. I mean, it is. Well, every RF device on the market has the approval to improve the appearance of cellulite. Nothing cures cellulite. All right. So I think one of the reasons my clinic gets really busy with cellulite treatments is because patients come to my clinic and say, well, I went somewhere else and they told me, 2 treatments or 4 treatments of this, I wouldn't have cellulite. Well, again, A, gravity happens, B, hormones happen, C, life happens, diet and exercise changes, and cellulite comes back. So I think that by having the dynamic muscle activation gives us one more layer of we're going to keep this healthy a little longer than your typical RF alone treatment. And so it definitely works. And I will tell you, for cellulite, in July of this year, we will have probably the first FDA injectable drug, which will be cleared for the treatment of cellulite, not curing, treating. So it's a collagenase inhibitor, and we've been studying it for 5 years. I've treated 250 women with this drug. Now, what we're telling the company is this plus radiofrequency is going to be better than the drug itself. And we'll start studying that in what are called phase 4 studies when the drug is approved. But we inject it, it'll have its first FDA approval for buttocks. The second one will be for thighs. But it definitely needs the RF, and the RF plus dynamic muscle is going to be better than RF alone. So again, combination therapies are how I'm going to approach cellulite in my after the summer mode when I can get my hands on this drug for real. Again, in my research facility, I've been doing it for years, but it's coming to the US, which means it'll be coming to the rest of the world shortly.
Perfect, lovely. Just a couple more questions before we wrap up. And they are, again, just clarifying that you can obviously do the DMA, the tripolar, and obviously the skin needling all in one session. How often would you combine all three together?
Well, again, it depends what you're looking for. So when we did our study on the face, we were just looking at tightening and the muscle, okay? You can definitely do the needling on top of that without any issues. I mean, there's no problem doing it. So for the luminous people in Israel, if you're listening, that's the next study we want to do in the US, combining all three. But I think that's important. I mean, I think we have to see the next phase is combining more of the technologies together. But in the real world, do it all the time.
Yeah, look, it's certainly one of the protocols I do a lot. I do all three. I get amazing results from it. It's very, very tolerable. And the clients, I guess, when they come in, they know that they're coming in, just recapping on your treatment protocol as well. We get them to come in every week. Obviously, every fourth treatment that we would do the skin needling. But you did say that you're doing the RF micro needling at intervals of 3 weeks. Is that correct?
So when I use, so if I'm doing IPL on top, then the protocol that we do is we'll do all three at 3-week sessions, but again, 4-week sessions in my real world, just because 4 weeks is easy to schedule. The study was 3 weeks. If we're doing all three of the technologies, I do them on the same day. If I incorporate an IPL as a fourth technology, then I won't do the needling that day. I do it a different day.
Yeah, no, definitely. And just our final question here, would you say for those people out there that are considering buying this device, is it more for face, is it more for body, or is it a system that you can incorporate into your practice that is going to do both very effectively?
So I think I think the way that I always have looked at this device, the tightening and the DMA is for body is gonna, that's a great everyday thing that we do all the time. I do a lot of needling and pin technology, so for me, facial work is very important. So I think they're both very important. I think both, again, I think it depends on your clinic, it depends on your clients. If you're a clinic that wants to treat cellulite all day, this is going to work great. If you have people that you treat circumferential reduction, fat reduction, and want to add this into that works great. If you deal with face, again, this is the only muscle activation that exists on the face.
Yep, definitely. This is actually one of my favorite devices at the moment. I absolutely love it, and I cannot wait to get back to Sydney to get my hands back on it. That pretty much wraps up all of the questions that we've had come through. Tracy's now going to pop on. Thank you so much for your time this morning. It was really informative, and I hope that you guys get back to working sort of semi-normal again very soon.
Yeah, and to everybody there, same thing. We want everybody to get back to normal safely.
Thank you so much, Rhiannon and Dr. Gold. Dr. Gold, thank you very much for your thorough overview of the Legend Pro Plus and for sharing the way in which you use it, as well as your various protocols. Thank you very much for your time, and we appreciate you joining us today.
It's my pleasure, and again, I wish everybody stay safe and healthy, and then soon I'll come down to Australia and I can show you how to do this all in person.
Absolutely. And then we'll go to Bondi Beach.
All right, everybody have a great night. I'm going to sign off. Take care, everybody.
Thank you. With that, I'm going to close out the webinar. Thank you.